Okay.
Okay. Hi, my name is Michelle Barres with Keller Williams, and I'm here with Dr. G at Trusted Dental Care. He's located right off of Country Club, almost right across from where they're building the college, down from the 7-Eleven. You just opened about how long ago?
We've been open since October
October?
of 2018. Yeah.
Okay. And so, what makes your dental practice a little bit more unique?
So just to give you a little background, I am actually new to the area. I never heard of Wylie before, and then I came here to check it out. I actually came to Dallas and checked it out. I love the place. I mean, I've seen all the activity that's going on. There's small community feel, and I just felt like I can fit right in. And so my interest just picked on and started looking. So March this time, it was my very first time here in Wylie.
Oh, wow, that was quick.
So March, it was a Saturday morning, came around, we drove around, it was a rainy day, and we come across this building and this area. It was just almost a dream coming true, automatically, I knew this is what I wanted to be, and we just got the clock rolling. We got the lease and all that done, so before the end of the summer, we were ready to do the construction and all that. And here we are. I mean, not too many months after. I mean, we were open in October, and we've we've been amazingly, the support, the community has been amazing support, and we're doing fantastic.
Oh, that's great.
And anyways, I know you're asking a question about what separates our practice. Really, my practice is just focused on the customer. I mean, we wanted to make sure that our patients have the best experience, and that's what we focus on. And we've got great reviews. We just want to make sure that our patients get what they deserve, and we're not here to sell dentistry or anything like that, but we plan to be here for a long time, so we want to make sure that we are going to be the provider of choice in the community. We're doing everything we can possibly do to get our patients to be comfortable, to be happy, and so what makes my practice very different than anybody else as well, we are planning on having every specialty here in the office, and so I don't want to send my patients somewhere else and new place, new office. And so the goal would be to bring in a specialty here in the office so our patient can stay here in the office.
Okay, so talking about that, when you're talking about specialties, what like we discussed like wisdom teeth, you would have somebody you can do that, but if there was something impacted or something major, you would actually call somebody in to do that.
So the goal would be, let's say there's 6 or 7 specialty in dentistry, from orthodontics to perio to oral surgery, and a couple more other ones, pediatric dentistry. So the goal would be, let's say that if a kid, 16, 17-year-old kid needs wisdom tooth extraction and they're impacted and they're going to be fully sedated, I wanted to have an oral surgeon come to the office and with their anesthesiologist in office, and so that they can get the teeth taken out comfortably. And I don't do sedation, and so but I want to bring in somebody who will do that. And so that's the goal. For example, that's just one example. The other thing would be orthodontics, for example. I would bring in an orthodontist here, so it's full house, full service, in other words.
Right, so people don't have to go search for all these different places, and because people have busy schedule with their kids just getting out of school and have to drive around town for all of this, so that makes sense.
Right.
So as far as what you do here in the office, what are some of the things? I noticed you do teeth whitening, which that's kind of a big thing these days for people.
Yeah, I truly believe, on bright and white and straight teeth, so everyone deserves to have a good smile, because the smile just tells everything. It's a story, you'd be surprised how many times you just had a smile on your face and people just connect with that.
Right.
And so the goal for us would be, what can we do to help you smile more? You'd be surprised how many times patients or people in general don't want to smile just because they don't like the way that tooth looks or the shade or anything like that. So we have different options. We have teeth whitening, and that's just an instant gratification. Patient come in, literally hour and a half in the chair, they can have a smile from they didn't like it to they love it. We see that all the time. We have different options. We have adult braces, clear braces. These are, if you've been wondering about for the last many years, you didn't have braces done. The technology is changing so much that even adults, there's a program we have. It's called 6 Month Smiles. In 6 months average time, you can get your teeth straight. Just
Wow.
It's gonna be, and it's at a cheaper price. That's the beauty of it. So what happens is, patient comes in, we take pictures, we take impressions and all that, and then we send it to a company. And so what they do, they scan everything and they do a simulation, computer generated simulation of how the tooth will move on every month by month, what the tooth movement would look like. And so you get a virtual completed case before you even start the case. And so you would sit down with the patient and you show them how the tooth will move throughout their treatment time. And it's fascinating.
Wow.
It is, yeah. And then so the patient do not have to commit to it until they actually see it. Once you see the teeth movement and you look at the final outcome, it's just no brainer. People want to do it.
Yeah.
So we have, like I said, we have different options. Teeth whitening is one example. Like I said, in an hour and a half, you can boost your smile, your confidence. I'm a big fan of, having a great time and smiling and laughing and all that. Can you imagine, what it can do? And so I truly believe in, getting people to, to get the smile they deserve, and that's what we're trying.
Oh, it helps you with confidence. It helps you get jobs. It helps you with everything.
Yeah.
So smell is very important. And as far as the other things you do yourself in this office, you do the standard cleaning and dental check and things like that as well.
Yeah, we do. Pretty much we do veneers, we do crowns, we do exam cleaning. We do have a 3D scan, CBCT, top, state of the art. So for us, we wanted to be ahead of, technology is a big part of the life we live in today. We can't fall behind. Obviously, as you can see, my office, we don't do shortcuts. We went out and, these chairs that you see, they're top of the line. You can see this is the exact same chair that you would find in White House. This is ADIC. I went to the actual company, I checked it out and all that. And so my patients deserve the best products. And so I just want to make sure that anybody, whether it's a kid, 5-year-old kid who's scared to come to the dentist, and all the ladies in their 70s, I want to make sure that everybody has great experience, and that's what we're striving for.
And tell everybody about that 3D scanner, because that was really interesting. Because I've been doing the whole dental thing since I was a kid, and I've never seen that before.
Yeah.
So.
And so
what does it do?
Yeah, it does many things. And so the 3D is actually virtually planning your case. Let's say, for example, you need an implant. Okay. So before 3D, you just look at an X-ray, but X-ray is a little misleading because it's just a 2-dimensional image. So it's just a projection of what could be, right? But at 3D, literally, I can move it, rotate it, I can virtually plan the implant, I can virtually place the implant. It's just another tool, safety factor for our patients. Again, this is virtually done before the implant is placed. You can virtually look at it, look at the bone, and then you can measure how many millimeters of, implant you need and how much, all that. You can do that virtually and then slam dunk. It just makes your treatment so much better.
It's nice to be able to see what the finished result's going to be before you do it.
Yeah,
that's kind of nice. It gets you excited to do it.
Absolutely.
You forget that it may not be the most pleasant thing or time-consuming thing, but it'll be worth it in the long run because you see it.
Yeah.
So that's nice.
Absolutely.
Okay. All right. So what are your hours here?
We're like I say, we're the neighborhood dentist, so we understand a lot of families around here are working families. So we open Saturdays, not every Saturday, but we at least open 2 Saturdays a month. You know, that's for those families who couldn't make it during the week or they have a busy schedule. We do have Wednesdays we are late. We open at 10, but we're here until 7. So we just, and again, you know, we do by appointments. We're very flexible. If a patient tells us like, I can't come, you know, because I have to be at work until this time, and they want it to be seen, we're happy to see them, you know. And
So you can work around
of
what
course,
people have going on.
absolutely.
Okay.
Yeah.
Okay. Oh, well, nice.
I mean, our goal, frankly, long-term goal would be have the longest hours. You know, once I have enough staff that can cover 2 shifts. And again, this is the short-term growth plus long-term growth. We plan to be here for a long time. And so our goal would be have maybe 2 shifts where we start early and then we go all the way to 7, 8 o'clock. And that's our ultimate goal. You know? So we have more
Okay.
coverage, yeah. Yeah.
Okay. Okay. Well, is there anything else you'd like to tell everybody?
Well, all I tell everybody is that come check out our office. We have an amazing team and we're having a great time. We're always, you know, for us, for my team, it really, it's not work, it's just fun. You know, we're very passionate about what we do and we have very passionate people. Compassion is our big driver. We're not here to, you know, like I said, sell the industry, but we're here as to help our community, to be here. And like I said, we plan to be here for a long time, so we're here in building a relationship with our community. And I say that come check it out. I personally, I love giving personal tours of our office and answer any questions you can possibly have.
Okay. Okay. And it is a very nice office. So you can tell you just opened. It's very clean feeling. It's very modern. It's a really nice office. So if you have any questions or if you want to make an appointment at the end of the video, I will post all the information to get a hold of Dr. Giera's staff. So you can go on, you have a website, you have a phone number, all
We
that.
have a website,
Mm-hmm.
very easy to remember. Actually, I'll give you, just before the closing, I know, our office is called Trusted Dental Care. And the reason the name even Trusted Dental Care comes about is dentistry is about being trusting. It's a relationship between your provider and the patient. And if there's no trust in between, you know, the dentist is not an option. So it's a trust-based relationship. And that's why, even for me to come up with the name, it was just, I knew dentistry is about trusting with your provider. And so the website is very easy. It's just trusteddentalcare.com.
That is easy.
That makes it easy.
Yeah. And then you'll remember where you're going because you just put it in on the website.
Yeah. No. Yeah. I
Name
mean,
on the door.
Once you get to the website, there's phone numbers, there's email option, all, you know.
Okay.
So let's go with that.
Okay. So again, if you have any questions for Dr. Giera's staff, the information will be at the end of the video. And Dr. G, I appreciate you giving me the tour.
Oh, thank you so much.
It's very nice
I appreciate
and
it.
taking the time to interview with me.
Thank you very much. I appreciate it. Awesome.